Ever wondered what happens during a liver transplant? Why is it even necessary? Well, a liver transplant is a surgical procedure performed when a person's liver is so damaged or diseased that it can no longer function properly. This could be due to a variety of conditions, from end-stage liver disease like cirrhosis or hepatitis, to acute liver failure caused by drug overdose, viral infections, or autoimmune diseases. Even some cases of liver cancer or inherited metabolic disorders could necessitate a liver transplant. When all other treatments such as medication or lifestyle changes fail to manage the liver condition, a transplant becomes a necessity. The goal? Replace the diseased liver with a healthy one from a donor, restoring normal liver function and vastly improving the patient's quality of life. It's a chance for patients to live longer, healthier lives. A liver transplant isn't a choice. It's a life-saving intervention for those with severe liver disease. Now that we've established why a liver transplant might be necessary, let's delve into the surgical procedure itself. A liver transplant is a complex operation that involves multiple steps, each crucial to the success of the procedure. We start with the preparation phase. The recipient is prepared for surgery by administering anesthesia. This ensures that they don't feel any pain during the operation. Simultaneously, the donor liver, which could come from a deceased or living donor, is retrieved and transported to the transplant center. Next comes the incision. The surgical team makes a large incision in the upper abdomen, typically under the rib cage. However, in some instances, a newer technique called laparoscopic assisted surgery might be used, which involves smaller incisions and specialized instruments. Once the incision is made, we move to the next step, the removal of the diseased liver. This is done with utmost care, preserving the surrounding blood vessels and bile ducts to make the implantation of the new liver as seamless as possible. The fourth step is the implantation of the donor liver. The healthy liver is implanted into the recipient's body. This involves connecting the blood vessels of the new liver to the recipient's blood vessels, ensuring a proper blood flow to the new organ. After the liver is in place, the bile ducts of the new liver are connected to the recipient's bile ducts or intestine, allowing bile to flow from the liver into the digestive system. This crucial step ensures that the new liver can perform its functions effectively. Once the new liver is in place and functioning, the surgical team moves to the closure phase. They close the incision with sutures or staples, marking the end of the surgical procedure. But it doesn't end there. The patient is then moved to the recovery phase, which is closely monitored in the intensive care unit or a specialized transplant unit. This is where the patient starts to heal and adjust to the new organ. Immunosuppressive medications are administered to prevent rejection of the new liver. The final step is post-operative care. After leaving the hospital, the recipient continues to receive medical care and monitoring. This is to ensure the success of the transplant and to manage any complications or side effects that may arise. So as you can see, a liver transplant is a complex, multi-step procedure, requiring the coordinated efforts of a multidisciplinary team. Each step, from the initial preparation to the final post-operative care, plays a crucial role in ensuring the success of the transplant. Remember, the patient's journey doesn't end with surgery. Recovery and post-operative care are equally vital. It's during this time that the patient's body starts to adapt to the new organ, and any potential complications can be identified and managed. This is a crucial period in the patient's journey towards a healthier life post-transplant. While liver transplantation can be a life-saving procedure, it's not without its complications. Like any major surgical procedure, liver transplantation carries some inherent risks. In the immediate aftermath of the surgery, there are potential complications such as bleeding, infection, and blood clots. The liver is a vital organ with a rich blood supply, and any surgical intervention carries a risk of significant bleeding. Infections can occur as the surgery involves opening the abdominal cavity, exposing it to potential pathogens. Blood clots can also form, particularly in the large vessels leading to and from the liver. Now let's talk about rejection. The recipient's immune system may recognize the new liver as a foreign object and attempt to attack it. This is known as rejection. To prevent this, patients are given immunosuppressant medications to dampen their immune response. However, these medicines can have side effects, including making the patient more susceptible to infections and certain types of cancer. Another potential complication is the failure of the new liver. This can occur soon after the transplant, a condition known as primary graft non-function. Or it can happen gradually over time due to chronic rejection or other complications. In such cases, patients may need another liver transplant. There's also the risk of bile duct complications, including leaks or strictures, narrowing of the bile ducts. These can lead to jaundice, infection, and other serious complications. Moreover, the psychological impact of undergoing a liver transplant shouldn't be underestimated. Patients may experience anxiety, depression, or other mental health issues. It's important to have strong emotional support and psychological care throughout the transplant journey. Finally, there's the ongoing challenge of managing life post-transplant. Patients need to take medications for the rest of their lives and have regular checkups to monitor liver function and detect any potential complications early. Despite these challenges, the goal remains to improve the patient's quality of life and extend survival. The journey may be difficult, but the potential benefits, a healthier, longer life, are often worth the risks and challenges. One of the most significant hurdles in liver transplantation is the body's potential rejection of the new organ. This natural response is your immune system's defense mechanism, perceiving the new liver as a foreign body and attacking it. There are 3 types of organ rejection: hyperacute, acute, and chronic. Hyperacute rejection occurs within minutes to hours after the transplant, acute rejection within days to weeks, and chronic rejection over a period of months to years. Thankfully, medical advancements have led to effective strategies to manage organ rejection. Immunosuppressive medications are administered to dampen the immune response and help the body accept the new liver. These medications, however, require a delicate balance. Too little might lead to organ rejection, while too much could make the patient susceptible to infections and diseases. The management of organ rejection doesn't stop there. Regular follow-ups and monitoring are crucial to catch any signs of rejection early on. Blood tests, liver function tests, and sometimes liver biopsies are conducted to ensure the new liver is functioning well and not being rejected. Now let's talk about survival rates. Due to advancements in surgical techniques and post-operative care, survival rates have significantly improved over the years. According to recent studies, the 1-year survival rate for liver transplant patients is about 85 to 90%. The 5-year survival rate is approximately 70 to 75%. These rates can vary depending on factors such as the patient's overall health, the cause of liver failure, and the quality of the donor liver. It's important to remember that these are just numbers. Every individual's journey is unique, and many factors can influence the outcome of a liver transplant. The key is in the meticulous management of the patient's health before, during, and after the transplant. It's a complex process, but with careful management, many liver transplant patients go on to lead healthy, productive lives. Now we know about liver transplants, but where do these new livers come from? Every year, many lives are saved through the miraculous process of organ transplantation. But this life-saving procedure wouldn't be possible without the gift of organ donation. Organ donation is a noble act that signifies the ultimate expression of human kindness, giving a second chance at life to individuals who are in desperate need of a transplant. When we discuss liver transplantation, it's crucial to understand that the availability of healthy livers is entirely dependent on the generosity of organ donors. Sadly, there is a significant shortage of available organs for transplantation worldwide. As of now, the demand for organ transplants far exceeds the supply of donated organs. For instance, in the case of liver transplants, there are thousands of patients on the waiting list, but only a fraction of them receive a transplant each year. This shortage of available organs often leads to prolonged waiting times, during which the health of many patients deteriorates, and sadly, some may even lose their lives waiting. But there's a silver lining. One organ donor can save up to 8 lives. This means that each one of us holds the potential to make a significant difference. Organ donation not only saves lives, but also positively impacts the lives of recipients by improving their quality of life and offering them a chance to live longer, healthier lives. Moreover, organ donation isn't restricted to deceased donors only. Living donors can also donate a part of their liver, as the liver has the unique ability to regenerate itself. This act of selflessness can create a profound, life-altering impact on the recipient's life. So let's all think about the power we hold within us. The power to end the wait for someone in need. The power to give someone a second chance at life. The power to turn the tide of organ shortage. Remember, each organ donor has the potential to save up to 8 lives. Consider becoming a donor today.